This is our patient. He's 38 years old and he's in good shape. He's healthy, but he has these very stubborn areas of fat, okay? What we're planning to do today is a high definition liposuction so that we can reveal the underlying ab muscles that he has, take care of these stubborn love handles that we all have, and also slim the chest down a little bit so it's not as prominent, okay? So it's just a gentle reduction of the fat there, pretty substantial reduction of fat down here, create a V shape, and then transfer it to the buttocks for overall more masculine physique. So we just got started with our liposuction. We have our tumescent in here and you can see the blanching that's happening here. That's because it prevents bleeding, all right? That's the epinephrine we put in tumescent. Now we've been working on the abdomen here and you can see we're doing high definition liposuction. So you see how you can already see this nice little vertical groove here? That's what we want. We'll also do some slight horizontal grooves, nothing too ridiculous, and then overall takedown of this area. And then we'll focus on the chest, the love handles, we'll focus on those, and then take that fat and transfer to the buttocks. We're taking a moment here to pause and just kind of seeing how everything's looking. The abdomen's looking pretty good. This is why I kind of sit patients up, because it's always weird when you see it sitting up. There could be some extra areas that you missed when they're lying flat. All right, so we're building up the buttock now. You can see we have this side approach, so we can get all the way down here to the middle, and then to the center portion right here. Looking awesome. So we're closing this up in multiple layers. And I always like to get this deep layer closed. It's airtight, okay? Because that really helps solidify this closure. And then we put some superficial ones to line up the skin beautifully. We're done with that beautiful male liposuction case, all right? Now there's a couple things that we had to do different because he's a male patient. We want to make it look masculine, all right? So overall back here, we want to make this V shape very defined. We want to highlight the lats on the sides, which we did, okay, with multiple access sites. And then we want to take care of these love handles, all right? They have no business being there. Very stubborn area. In addition, we did the chest. We don't want to overdo the chest. We want a gentle reduction because we still want some fullness there. We don't want to be completely flat. And then we did a high definition liposuction on the front here. Okay, so he's going to have a lot more definition of his abdomen in addition to continuation of that V shape on the front. Now, the next part, we took that fat, we transferred it to the buttocks. So now the buttocks are going to start a little bit down here. They're going to be much more full, especially on the side profile. He's going to have a little more projection. He's going to fit in the pants and the clothes better. It's going to look great overall. Huge transformation in a masculine way for our patient. Okay, now expected recovery for this, 2 weeks off your butt. You can't be sitting on your buttocks, all right? But that doesn't mean you're like writhing in pain for those 2 weeks. Generally, the first couple days are kind of soreness, like you hit the gym for the first time after like not being in the gym at all. His full results are probably not gonna develop until about 3 months when the majority of his swelling goes down. Sometimes people have a residual swelling lasting up to 6 months. The biggest thing I tell people after recovery is to make sure you drink lots of fluids because we took off all of this volume, you third space the fluid, so you wanna keep your hydration up while you're recovering. That's it for our male liposuction case, you guys. I hope you enjoyed it. If you want to see more videos just like this, check out my website, drdanielbarrett.com. And as always, feel free to leave your comments, questions, feedback right here on my YouTube page. If you want to see more videos just like this, don't forget to give me a thumbs up and subscribe.